Hello, I am very excited to tell you about bioidentical hormones, something that I've added to my practice that now can help you feel as good as you look. Hormone optimization is something that I added to my practice a little over 3 years ago after doing probably about 7 or 8 years of research, getting comfortable with the whole idea. When we look at how we age, we know that our glandular system really starts to diminish, meaning thyroid, ovary, testicular function. And there are certain symptoms that come along with this deterioration. And so what we see is loss of muscle mass. We see basically increasing fatigue, decreasing cognitive function. In women, we see hot flashes and night sweats. Men and women both, we start to see mood changes and an increased incidence of depression. And we know that this all correlates very well with the dropping levels of hormones. Unfortunately, when you talk about hormone replacement, the first thing that comes to mind for most people is cancer. And you need to understand that hormone replacement therapy was pioneered by the OBGYN community years ago. And unfortunately, they chose to use synthetic hormones by an oral route, right? And, we call medicine practice for a reason, right? We need to learn. What we learned from that experience was what you put in your mouth is metabolized by the liver, and something different can end up at the end organs, right? And so, yes, there was a 7% increase in breast and uterine cancer during that period of time. But what people failed to see was there was a 70% decrease in the incidence of cardiac mortality in women, meaning that women had a heart attack 1/3 the incidence of men. Today, the incidence of heart attack is the number one cause of death for both men and women. And that's all because the American College of Obstetrics and Gynecology no longer supports the use of hormone replacement therapy. Now, backing up to synthetic hormones, it was never the estrogen that was the problem. It was the breakdown products of the progesterone or the progestins that caused breast and uterine cancer. Bioidentical hormones avoid that route by being delivered either topically through the skin or, my preferred method, pellets under the surface of the skin. And so if we look at aging, and I'm going to go back to that. I'm very visual, so I like to see visual things. And if we look at hormone levels in age, and we look at our sexual differentiating hormones, they peak in our 20s, and then they just gradually kind of diminish. Cortisol, which is a stress hormone, doesn't do anything really dramatic. It just kind of goes up throughout life. But what's very interesting is this point right here, and that averages around age 45. And so what we see at that point is what makes us uniquely men and women now falls into the lower position. And cortisol, the stress hormone that breaks us down the same. And so how do we see that visually? I think we all know people that have been married for 50 years, they go on vacation, they put on the same outfit, and they take a picture to celebrate. And when you look at that picture for the first second, who's the man and who's the woman, right? And that's what we see as we age. Our extremities thin and our trunks become full, and the things that make us uniquely men and women are diminished, right? So we now have the ability to keep our sexual differentiating hormones higher than cortisol, right? And so what we see is not only the immediate short-term benefits with absence of hot flashes and night sweats, more energy, better cognitive function, elevated mood are the short-term benefits. But if we really look at long-term benefits, and we have great studies now over 20 years using bioidentical hormones showing a decreased incidence of osteoporosis, a decreased incidence of coronary artery disease, and a decreased incidence now of Alzheimer's disease. So we see both long and short-term benefits. And so for me, it's been a wonderful addition to my practice. I would say roughly 35% of my patients are peri and postmenopausal. 90% of my patients are women. And I could make everybody look fantastic. But up until about 3 years ago, I couldn't make people feel good. And so that addition to the practice has just been fantastic, because now I feel like I can make people look as good as they feel and feel as good as they look.